Thank you all so much for joining us for our webinar today. We have you until 2 p.m. ET or just to the top of the hour, wherever you are. Welcome to Building Ready and Responsive School-Based Health Center Telehealth Programs. Some quick reminders before we jump into content is that all of you are in what's known as listen-only mode. So if you'd like to ask a question of our presenters during our session, we invite you to use that Q&A function at the bottom of the screen. It's very easy, type it in. We'll have time for Q&A at the end of our session. So promise we'll get to you just again at the end of our presentation. If you'd like to turn on closed captions, there should be a CC button also at the bottom of your screen that you can use. We would love it if you could complete our evaluation poll questions that we will launch at the end of our presentation. And as always, the recording, slides, and additional resources will be shared via email and will also be posted on our website for you to find later on. If you're curious about learning more about our work and the things we do for and with school-based health centers, we invite you to check out our website at www.sbhforall.org. You can find more about our current initiatives, past initiatives, resources, webinars, all the great things on our website. I am proud to be co-hosting today. I am Harper Byers. I'm a coordinator at the School-Based Health Alliance. Been here for about 5 years and really excited to just have you all here and talk a little bit more about telehealth. I am joined by the lovely Danielle Dobbins. If you want to come on and say hi, she'll be chatting more soon.
Thank you, Harper. Good afternoon, everyone. Thanks again for joining us. I'm Danielle Dobbins, director here at the School-Based Health Alliance. Since 2022, I've been working with our National Training and Technical Assistance Partner work, for which this webinar falls within, along with some of our consulting as well as fiduciary projects. So happy to be with you all. And I want to introduce our presenters for this afternoon. So we are lucky to have 3 dynamic speakers join us. I'll start off with Davia Smith. She joined the Palmetto Cares Connections team back in 2014 rather, as the Chief Community Relations Officer. Davia leads all the educational and community outreach initiatives to increase telehealth awareness as well as digital skills. As a native of Hampton, South Carolina, Davia is very passionate about accessibility for rural and underserved areas. Sharing available resources with family, with friends, and community members is something she does even off the clock. She really believes it is not enough to just have resources available. Davia believes we must also build relationships that allow us the opportunity to connect, empower, and transform. Davia received her undergraduate degree in business administration from the University of South Carolina, Aiken, and holds a master's of health administration degree from the Arnold School of Public Health at the University of South Carolina. We are also joined by Liz Seitz, IT Director for Community Engagement at Palmetto Cares Connection. She focuses on expanding access to technology, telehealth, as well as digital literacy resources in underserved communities. She holds a Bachelor of Science in Integrated Information Technology. She brings a strong background in using practical, community-centered technology solutions to help individuals as well as organizations better connect to care. In her role, Liz supports initiatives that bridge the digital divide. She helps to improve access to virtual health services and strengthen technology education for communities that may face barriers to connectivity, devices, or digital skills. Her work really reflects a commitment to making technology more accessible, understandable, and useful for people and communities that Palmetto Care Connection serves. And also, we're joined by Bretta Kittrell. She received her Bachelor of Science in Nursing degree from Clemson University in 2010. After graduating, she spent 5 years working in the surgical trauma intensive care unit at Palmetto Health Richland and then 3 years in the operating room at the Regional Medical Center. In 2017, she graduated from Graceland University, where she specialized in family medicine and received her Master of Science in Nursing degree. Currently, she works as an FPN at Bragmore Family, where she has practiced since 2018. In October 2024, Bretta moved into the full-time telehealth provider role, and she also helps to manage the school-based telehealth and remote patient monitoring programs. So welcome to each of you. Thank you all so much for being here. I'll turn it back over to Harper to share today's learning objectives.
Sweet. Thanks, Danielle. And again, huge welcome to our presenters. I'm really excited for you all to hear the great things they have to say. So to ground us today and talk a little bit more about what we're going to touch on, our learning objectives are that participants will be able to identify strategies for effective partnerships between school-based health centers and school communities to support telehealth implementation, and apply practical approaches to improve coordination and rapid response, ensuring efficient telehealth delivery that supports positive student health outcomes. Again, to just provide a little bit more about what school-based telehealth is, I'm going to go over some important concepts and thoughts and ideas. Quickly grounding us with why school-based telehealth matters. We know that school-based telehealth can help centers increase access for students who face barriers to care, support a timely response for students who have needs and provider needs during the school health day. It extends the reach of school-based health centers through virtual care, hybrid models, or telehealth networks, and it strengthens coordination among and between health centers, schools, families, and community partners. And last but certainly not least, it helps reduce missed class time by connecting students to care where they spend most of their time in school. Just want to note that school-based telehealth is not a replacement for in-person care, but just one strategy that health centers can use to really expand access to care and respond to student needs more effectively. There are three kind of common delivery methods for school-based telehealth programs. This is not exhaustive, but this is what we see most commonly. So as you plan your school-based telehealth program or think a little bit more about what you would like to do, just important to weigh the benefits and considerations before deciding what works best for you, capacity, and sustainability-wise. So the first, it's a little bit of a cheat because it actually has two. So the first is Comprehensive School-Based Health Center plus telehealth. So Comprehensive School-Based Health Center plus hybrid telehealth is students accessing in-person comprehensive care from on-site providers at their school-based health center and then receiving specialty care services via telehealth. That second bucket, where Comprehensive School-Based Health Center plus telehealth network, is a school-based health center delivering comprehensive care to students in that school and on site, and then expanding access to others by a provider delivering care via telehealth to students at other schools, which we call satellite schools. The kind of second main model that we see is a telehealth network plus rotating on-site services, where a health center does not sponsor a traditional on-site school-based health center, but instead the health center provides telehealth care to one or more schools, and then providers will regularly rotate through the schools delivering in-person care. And then the last is what we call telehealth exclusive, where students can access care at a fixed location on a school campus, something like the school nurse's office, and then providers are available remotely for all services. As you think about getting started, there are two main things that we recommend. One is conducting a needs assessment. So figuring out really why do you want to incorporate this school-based health telehealth program? And then underneath, really addressing four main things. So what are the needs of your students and your community, and how can telehealth help address those needs? The second is capacity. So what are your staff willing and able to do? What is the capacity for them to expand their programming that they're already doing and take on this telehealth work? What is the demand? Is this something that students are asking for? Is it something that parents are asking for? Or is this something kind of that you see as solving some of those needs and capacity issues that you might be facing? And then all of those can help address what your priorities are as you get started and kind of what you would like to address first. And that can really help inform which model is right for you. That second piece of getting started that we recommend is conducting a readiness assessment of what's already happening and is your health center ready for this new telehealth model. So the first is figuring out what support looks like. Second would be figuring out staffing. So are you going to need to hire new staff? What would training look like for staff that are already there and able to take on this new work? The third might be your technology needs. So you'll definitely need to figure out what technology, your telehealth technology you'll decide on, and making sure again that you have staff trained in how to use it. Also thinking about things like Wi-Fi or how you'll get connected. And then last but not least is what funding is available to support your staffing and technology needs, and then figuring out how that can help inform sustainability. So one thing that we think is really important, whether you're adding telehealth to your existing school-based health center or this is kind of your entry into school-based health care, is that collaboration can really help build trust, increase awareness, and improve program enrollment. So successful programs often have three following elements. So they've got the planning group, the advisory committee, and then program champions. So the planning group will be a group of people who are really starting at the beginning. They might be helping out with those needs assessment and readiness assessments, but really thinking about what do we need to do to get this program off the ground. Your advisory committee can be in charge of figuring out what's working, addressing those community priorities, and incorporating feedback, maybe helping improve things and scaling things up after your first pilot program. And then the last bucket is champions. These individuals are people, might be community members, it could be caregivers, it could be a provider who's really passionate about telehealth services. But these people might be in charge of increasing awareness and increasing enrollment. So really making sure that you're telling their stories and using them to increase the use of your telehealth program. As you think more about implementation, this is kind of where we want to address sustainability, and what can keep students coming back and community members to also champion your program. So really ironing out your workflow in a pilot, starting small, seeing what works, seeing what doesn't, and then using that pilot to scale to other sites, or inform something like a toolkit that you can then use in other places. Setting up this space, making sure that your technology is all set, it's all working, doing some dry runs, and then also making sure it's inviting and welcoming for students, making sure that they feel comfortable with this new form of care. Um, Really clarifying your policies and procedures, making sure that all your staff are briefed in how to use technology, making sure that there's kind of a game plan set in place for each visit. The fourth is really writing out your operations manual so that when and if new staff come in, they are all ready to go. They are already briefed on what they need to do and are really prepared to start helping out with this telehealth program and within visits. Staffing models, this is going to vary widely. Again, as we say, you've seen one school-based health center, you've seen one school-based health center. So just seeing what staffing model works for you. But again, making sure that everyone who needs to know knows, using something like a RACI or a MOCA model, to really figure out who needs to be in charge, who needs to be informed, and who we can bring in when we need some help. The last is training. This is not just a one-time thing. You want your staff to be continuously learning and continuously training. If you change your equipment around, you want to make sure that your staff knows how to use it. Again, if you bring in new staff, they need to be trained as well. So making sure that training is happening early and happening often. If you have any more questions kind of about how SBHA recommends different telehealth models and programs. I encourage you to check out our telehealth playbook by scanning our QR code, or you can just keep an eye out for the follow-up email where we will share this resource as well. And with that, I am proud to pass it over to our presenters to talk a little bit more about their experience in school-based telehealth.
Thank you, Harper and Danielle, so much for inviting us today to present. Good afternoon, everyone. My name is Davia Smith, and I'm representing Primary Care Connections today, along with Liz, and we'll just hop into it. Our objectives today is we'll describe how to implement a school-based telehealth model, one of many which can be done, and then we'll also cover some challenges and solutions that we've experienced with implementing school-based telehealth in a rural community. Next. I would like to share just a little bit of background about PCC, or Palliative to Care Connections. We are a nonprofit organization located in South Carolina. We serve the entire state of South Carolina through broadband, technology, telehealth, and educational programs. Initially, when we launched in 2010, we only provided services towards healthcare providers, but since 2021, we've launched a digital literacy program to provide training to patients in the community so that they're aware of how to do telehealth visits, as well as have the device to do it and have the connections, the internet connectivity. So we kind of we're now a well-rounded, almost a one-stop shop place, and we love it because our mission is to improve access to healthcare services in those rural and underserved communities in South Carolina. Rural is really what we live, because more than 95% of South Carolina is considered a primary care health provider shortage area. So this is what we're one big community, and we're about connecting each other to the resources that we have. As mentioned earlier, telehealth is not here to replace in-person services, but it's a tool that can enhance that connection. And before we go to the next slide, I would like for Bretta to just share a little bit of background about Bamberg Family Practice, which is where she's representing today too.
Good afternoon. So I work for Bamberg Family Practice. We currently we have 37 employees, have 7 providers, 1 MD that works here, and then we have 6 nurse practitioners, advanced practice providers. And we do currently have 2 full-time telehealth providers in-house. I fill one of those roles. In our office, we service you. I tell all of our patients we're a one-stop shop. So we do primary preventative care. We do chronic care management, remote patient monitoring, telehealth, as mentioned. We also have in-house lab, X-ray, ultrasound, DEXA, mammography, and then we also do our school-based telehealth, which is a role of the 2 telehealth providers in the office. And being in a rural setting, as Davey has mentioned, we have to provide care in a lot different ways sometimes. We're about 30 to 45 minutes from a bigger hospital. Our emergency room is 20 to 30 minutes away. So we do have to provide care definitely a little differently here. So we love offering these services. And I'll just put out there, I'm actually from this area. So being able to serve the people in this area is just is a passion that.
Thank you, Bretta. Harper covered what is school-based telehealth earlier, but I would like to just add on that the common conditions that are treated: allergies, asthma, ADHD, medication refills, colds and sore throat, mental health, behavioral health, and then we've added a few pictures just to share what some of the equipment can look like. Pictured on the screen, you'll see a stethoscope and the otoscope, the horoscope, and these devices include cameras and technology that just enhances the audio and visual for the telehealth appointments. And I'm sure that Greta will give you some more information down the road that just shares how much those tools actually help, even in person, So we'll move on to our next slide about our model. So we've introduced our team, Palmetto Care Connections, and also we have Bamberg Family Practice, who's a very close partner of ours. And so our model looks like this diagram shown where we're all interconnected. We have the telehealth provider, which is Bamberg Family Practice. We have the telehealth network, which is Palmetto Care Connections, and we have the school. The telehealth network, or PCC, the role that we fulfill right now is that we add on or we fill in where there's spaces needed to help launch the program. We will help with program implementation as far as providing, finding the technology, the equipment, the training, the education. We also provide some telepresenter clinical hours to, as this transition and implementation occurs. We're not here for necessarily to add staffing, but we're here to just support the program needs until they are able to find that sustainable um, model that works for them. So um, before, I think we have a little bit. I have a little bit more to share, but I wanted Bretta to chime in before I go to the next one.
One thing this slide speaks to me is relationships. With how we've implemented this process since 2024, one thing that is big is that all three of these entities work together and develop a relationship, just to develop trust, reliability, and that's what's made this strong and successful. Is if I can make a phone call to my PCC team when I'm having technology issues or I need a telepresenter out, someone there to help the nurse out. Just building those relationships is key, and we'll go into that a little more in depth and a little later in the slides too.
And so I'll give a little bit of background about the history of the program. We actually launched the school-based telehealth program prior to COVID, almost about 10 years ago. And what it looked like then is not quite how it looks like now. And as we go through our challenges and solutions, we'll come back to what I'm about to say. But when we initially launched the program, there was the staffing at BFP, or Bamberg Family Practice, looked different than what it does now. Palmetto Care Connections was not providing the telepresenter clinical hours, and also the schools were not necessarily sure how to fit the program into their existing workflow. So how we tried to do things before, um, you give it a little bit of time to try to make it work and see what's working, what's not working, getting feedback. There was a lot that we had to learn, and then the pandemic happened, and across the world, it showed us how technology can be useful in different ways. And so we came back to the drawing board and found some things that works for us now and that were necessary to go or to use moving forward.
And just some input I'll put into this. So as far as the scheduling goes, so you'll see in this model that the school nurse would contact, after contacting the parent, receiving consent, they would contact the provider or the telepresenter. We have opened that up to offer a lot of different ways of how the patients can schedule now, or the parents can schedule. So we do a lot of the nurse contacts one of us when they're ready and they have a visit. But they also are allowed to schedule, if they're a patient at our office, they can call over here and set up an appointment the day of. They can pre-schedule an appointment 3 months out, to whether they call and say, hey, I want to schedule this at the school. I can't take off work. So we do allow them to do that. And then we have brought in a telehealth assistant into our program at Bamberg Family as well, and they can call through that. So just we've made the changes to make it a quick feedback where somebody's not sitting there waiting. The nurse isn't holding a student for 2 hours, and making it convenient for the nurse, the parent, and the student. So I'll talk a little bit about the outcomes and successes. So as we said, this program, we started in 2024, 2025 with our revamp, as Davia mentioned there. So one thing we do a little differently, if you see in this chart, not a lot of school-based telehealths offer care to their staff at the schools. We felt that would be very beneficial because not only do we need to keep our students in the classroom, we also need to keep our teachers and our staff in these schools that teach these children and that they are comfortable with and that they learn under. So we also offer this service to the staff members within the school district and our university that we serve as well. Um, and we offer to any school age child. So we file insurance, whether they have Medicaid or private insurance. We file their insurance. As far as the staff goes, we do that a little different. If they are a patient at our office, we file just like we would if they were seen in the office. If they are not a patient, they do have an option to pay just a set fee that we have established. And just, we try the way we've made these numbers grow. And again, we'll get into this a little more, is just establishing relationships of them knowing who we are. We're not just the person behind a computer screen. We're at community events, we're at school events. They know where our office is. They see us outside of our role of being a provider. So being that, and just word of mouth. When one parent's done a visit and didn't have to leave their office for a whole day of work, word of mouth in a rural area spreads very, very quickly.
So to get these outcomes and successes, we did have many trial and error instances. So of course, like we talked about earlier, equipment was needed and internet was needed. But then we kind of started from the ground and worked our way up. So we established all of our processes through the telehealth network. We trained all the nurses and staff, and Harper mentioned before about the needs and readiness assessment. All of that included creating manuals, which we'll talk about a little bit more in our implementation. But just a key part of these outcomes and successes were our challenges. So if we can go to the next slide, I'll talk about that a little bit more. So just to start, this is our implementation checklist that we would recommend, at least from the beginning, is making sure that we have that telehealth infrastructure, and that's just basic broadband or internet and equipment in the school setting. Then the telehealth training and staff came, where we were figuring out if we were going to have a dedicated provider, if we were going to have a telepresenter, and then training all of those people along with the school staff. Policy and compliance guidelines. We work with the school to get a BAA in between BFP and the school, since they are the primary provider. And that included us as well as the telehealth network. If you are a direct healthcare system or a provider that's going to work directly with the school without a additional third party or telehealth network, your policies and guidelines might look a little bit different. But we also had to have these in place because, like Bretta said, Bamberg Family Practice doesn't only see their patients within the school, they will see any student. After the compliance guidelines, awareness and promotion and building relationships, like we stated before, was very important for us. We had to educate the community at first, because even though a lot of community members did telehealth during COVID, they still didn't realize what exactly it was, or some of them did not. So they said, yeah, we talked to the doctor on the phone, not realizing that that was a form of telehealth. So we also had to attend open houses, PTO meetings, even sporting events, kind of just to get Palmetto Care Connections as a telehealth network, and Bamberg Family Practice. We needed to get our name out there so that people within the community were familiar with us. And then building relationships came with the community, but it also came with the school nurses and the school administration. At first, even though we had that BAA in place, we're a smaller school district, but it was still very hard for even all of the school nurses and all of the front desk staff to become familiar with us. So our telepresenter would go into the school, and sometimes they would get questioned about why they were there. The school nurses, sometimes were hesitant to even let us be a part of their daily task just to kind of see what kind of workload they had. So it took a lot to build those relationships up to where we had trust from the school system and from the community. And you can go to the next slide, please. So these are just two examples of how we built relationships. We did a lot of different student and staff giveaways, we say. Sometimes there were competitions. So, for instance, the basket that you see, that was a competition that we did with the school nurses to kind of see who all could get the most visits done at their school for the year. So then, they got a little gift card and a little goodie basket. Another competition or giveaway type situation that we did were the book bags full of school supplies for the students. And those were given to, we did a raffle. Any student that got their consent form submitted before the first day of school, they were submitted into a raffle, and then their student was given a book bag. And we did one for each of our school levels, so elementary, middle, and high school. Then we try to do, gender neutral as well. We also, that's not pictured, we do an annual nurse lunch with all the nurses from the district. They just come to a off-site location, have a nice lunch, and we kind of talk about challenges and successes. Since we started, our very first lunch was honestly to kind of just get everyone together and say, hey, we're all on the same side and we're all working toward the same goal. But since then, it's evolved into a very productive meeting that we get to have. And if anyone has any more questions about any other giveaways or ideas that we have, we did a few more, but just to stay on time, we can keep going. This was just a parent testimonial from one of our parents. She stated that as a working parent, telehealth has been incredibly beneficial, that she doesn't have to worry about taking time off work so much or rearranging her whole schedule for a doctor's visit. And then another way that we collect these, which I think is important that we've started, is after each telehealth visit, we do conduct parent surveys. So that's been a way for us to, one, improve our services, but also advocate for the program. Next. And so this is a list of what we kind of already talked about with the solutions. So getting the schools to buy into the program meant that we had to meet and build those relationships. Another issue that we face where our school nurses are very, very busy all day. Our elementary school is K through 6, and there are 2 nurses on staff, but they stay busy with medications, and we have recess starting at 10 a.m. going through 1:30 p.m. So constant students coming in and out for that. At first, before Bretta was able to be dedicated entirely to telehealth, some students were having to wait from the morning until the end of the day, maybe, or when they got home to get a visit. So we've greatly improved on that. And then the other 2 are still just the same thing, building relationships. So going to those events, those school fairs, even if it wasn't school related, any community health fairs we attended. So we were really busy outside of the office too, trying to bring awareness to our program. Next.
I can go into my part here. So as a school-based telehealth provider, our goal was not to, we mentioned, change who their primary care physician was. That's a big misconception of people didn't want to do a visit because they didn't want to change who their primary care was. But just to offer care in a setting where seeing their primary care physician wasn't available, a specialist didn't have an opening, and in our school setting, there are a lot of children who do not get care or do not have a primary care physician. So they're either taken care of in the ER in an urgent care where there's no familiarity with them of who they are, what are their conditions, what do they, where do they live. So offering to those set of students as well was a big push for us. But as you guys know, in many primary care offices now and health clinics, there are a lot of days where we don't have openings to put people. So this offers an option, if they don't have an appointment until the next day or 2 days from now, they have an option of where they can be seen that day. So the regular follow-ups, this is something we started. So we started as just doing acute visits, sore throat, cough, flu symptoms, strep. We've implemented doing some of our patients' actual chronic checkups as well. So one thing that I learned also on the School Improvement Council in our school district is that parents having transportation or being able to take off to work so that their children are able to stay on their daily medications is a big struggle that was spoken of by the nurses and the teachers within the school. And being able to offer this within the school where mom, dad, the caregiver can log on to the visit was very, very important there too. So being able to do their regular follow-ups within the school was also something big that we added.
I just wanted to add one thing, one note to mention about the how we started getting as we build out a relationship with the school, that we also realized that it was important for us to not um, come off as appearing to add to their existing workload, that we were there for support and trying to just, we had the same goal. We would like to build a healthier community as the same as they would too. So we learned what their every school is different, just like every person, every child, every student is different. Every school is also different. So we had to observe kind of what their existing workflow was. And one of the things seems very small on the scale, but is very important, is the consent forms for getting the students enrolled into the program, or consenting to telehealth. Um, Going and trying to drop off forms on October the 3rd is different than going to the school when they're putting together all the parent packets or guardian packets during the summer in July before school begins. That made a huge difference with seeing enrollment numbers. But that would have never happened had we not sat down to have a conversation and build those relationships to understand where they're coming from and where we're coming from, but also just, the connections. It continues. It's it's important to listen and to learn as we build these relationships. I just want to
And
chime in.
I'll add to that a little bit too, Davey. I forgot to mention this. With the primary care, specialty care, I mentioned that we're not taking over those roles. Our goal is collaborative care, and that is providing what that student needs, what that staff member needs. And sometimes that's multiple entities working together. We will
Mhm.
fax office notes to primary care. We will call and talk with their primary care, their specialists. So our goal in all of this is not to create a competitive market, but to offer the best care we can for the people in these settings.
Yes. You're right.
One of the ways that we're trying to close the gap and not add more work to the school nurses is to implement a telepresenter. So if your program has not thought about this, it has been a great help and addition. I do think it's one of the reasons why the program was able to start to become more successful and stay um, sustainable. So a telepresenter is just a trained staff member located normally with the patient, and they assist with anything from the technology to the consents to making sure there's a private room for the patient, and even after the visit, surveys, things like that. And it does not have to be a medical professional. There's just in South Carolina, there's a AHEC telehealth presenter certification. We do want to make sure that the telepresenter follows all HIPAA compliance laws and things of that nature. But after that telehealth presenter certification, there are also telemental and telestroke certifications that people can obtain. So even if there's a community health worker, if there's a social worker within the school, if there's a retired teacher who's just in and out sometimes for help or maybe a resource teacher, they could always get certified. That way the school or the entity has multiple different telepresenters. Ours comes directly from our telehealth network from PCC, and like Davia mentioned, she has clinical hours set in each school that we assist with. So that's normally when the scheduled visits are conducted as during her clinical hours. If it is another visit or a more emergent visit, like Bretta mentioned, Bretta or the school nurses will just call the telepresenter, make sure she or another telepresenter is available, and then they make accommodations to get to the school or location where the student is. So that's been an extremely, extremely big help.
So the wait times. So I worked on the floor as a provider for 7 years before I took on the telehealth role. So I've been in both roles of this, trying to work in a school-based telehealth in the middle of seeing patients in the office when you're 10 patients deep, to going into the full telehealth provider role. And prior to having this dedicated role, which is hopefully accommodating for some people to be able to do, there were wait times. Some of these students were sitting in the nurse's office for 2 hours. Like Liz said, they were having to do visits once they left the school if they were a patient of ours. Just having time to stop and be able to do that. With now, the nurses can call and they know that most of the time they log straight on to our DoxyMe, and one of us is going to log in. They will call us and say, hey, I have a patient. We need to do the visit because they're busy. They've got kids in and out constantly, and having a student sitting there for 2 hours, it's just not feasible for them. So we've seen a big reduction in time with having a dedicated telehealth provider. And I don't only just do the school-based telehealth, I also do our in-office telehealth. But this role is just a lot more flexible than some of the floor can be, especially because some of our providers downstairs do see anywhere from 23 to 28 patients a day. So trying to work into their schedule was definitely a little difficult. So allowing those nurses to be able to schedule immediately, to be able to schedule during times that weren't med admin times for them. They would tell us we like early morning or we prefer late afternoon. So we were able to work with them and ask what their preference is. And then also for the parent, can we do this visit during their lunch break so that they're not having to take time off? So just being able to accommodate everybody to a time efficient matter. And like I said, I'm locally from this area. I took care of a lot of these patients on the floor for 7 years. Having that relationship already established, again, built that trust that, hey, it's not just some random person behind that screen that'll be taking care of them.
I'll kind of start. Um, Photographed is our telepresenter, and Bretta, our provider, and they are at our high school at one of, I think, an open house or one of the preschool events. So there are a lot of things that we participate in event wise, but also we do a lot of surveys, especially during the pilot of the program. We did nurse feedback surveys after the first year that we all were participating in the program. That helped us learn the workload of the nurses, as well as some common things that they see multiple times a day. We did the lunch and learn with the nurses that's turned into an annual event. And then, Brett, I'll let you talk about how your involvement in the school has helped as well.
So being involved in the School Improvement Council, Parent Teacher Association, it just allows us as the provider and as the staff coming in with this program, or what are the areas of struggle that they have? Um, where do we need to come in and try to take a load off of them? And a big thing with one of our bigger schools was attendance. Attendance is a big issue. So how could we come in and improve that attendance issue that they have? So one thing we made changes with now, instead of sending our excuses to the parents, they go straight to the attendance truancy clerk at each of the schools to make a faster turnaround on our truancy rates. Which were incredible. The drop in those, I think we went from 80 students last year to 11 this year, truancy, and not taking credit for all of that because our truancy officer definitely put in a lot of work to make that happen. But just knowing that that's an area, and with Voorhees University, we haven't talked a lot about that. We do their community resource fairs. They have an STD HIV awareness event that we participate in as well. And then this upcoming year, our push is going to be mental health. So we're planning on participating in some events that regard to that as well.
So we just have a video of the program that we would like to share. And then we'll come back and kind of wrap it up and open for questions and answers after that.
I think for the sake of time, we are going to send this in a follow-up. We do have some questions that I think we want to get to before we do close out. But
Okay.
I'm excited to send this to folks, so it's really informative.
Just for additional resources and purposes, we have listed a few, including our website, we have listed a few additional telehealth resources you can check out at your convenience. And then we also would like to share that we are the hosts of the annual Telehealth Summit, and we have a free school-based telehealth program pre-summit session scheduled on August 31st. It is free at no cost, and you can visit our website to register or just contact any of us after this event. That's all we have. We'll do questions.
Awesome. Thank you all so much. This was such an informative session. We had some great engagement with questions. So I'm hoping that we can get at least to about 2 or 3, and this is open to anyone on the panel or everyone on the panel who wants to answer. The first one is, how do you confirm confidentiality between you and the patient, specifically like with the patient's location? How does that work?
I can kind of answer that. So as far as confidentiality, we do confirm with the telepresenter, whoever has them there, they're confirming who the patient is, what their date of birth is. And then we have delegated spaces. So we do have space in the nurse's office where they have a separate area to work. But most of our schools, we have a separate room where we have our telehealth equipment set up. to where they're able to take that parent or that student into an area that is quiet. Nobody's walking in and out of like some of the nurses' offices can be.
Oh, that's great. Thank you. So the next question is related to the telepresenter. Is the school nurse involved in the visit with the telepresenter, or is it strictly the telepresenter? And if they do not have clinical training, when you are going over the certification and saying they don't necessarily need to be clinical, um, so how do you do any type of POC testing is the question.
I will say our telehealth presenter is well versed in doing any oh goodness, any pre like workup for the visit. But then also our telehealth network is sort of moving out of our position, especially as our school nurses are becoming more or more apt to doing the visits themselves. So if the telepresenter isn't comfortable doing anything that Bretta asks, she will ask the school nurse for assistance. And then sometimes we have the school nurse already doing all of those things before the visit if they are the ones doing it without the telepresenter present.
And as far as going to point of care testing, so none of our schools do in-house point of care testing like streps, COVID, flus, urines, things like that. We are in a very, very good location. We're right across the street from one of our schools. So a lot of times we will say, okay, I put in an order. You are to come over to the office. They're going to bring you to the back, do your COVID and flu test. We'll call you with results once we get them. So we do most of the point of care testing within our office.
Awesome. Thank you for sharing those details. I'm sure like all of these details really help people think through their process. So we had another question come in. Our attendee is saying that they're interested in how many virtual appointments your providers are able to do within a day. And you may have to like detail if there's a difference between behavioral health or other types of visits, but if you had any numbers that you could share around that.
So, as our office telehealth provider as well, I do a mixture of both. So, a lot of times it's bouncing back and forth between a school based telehealth and a regular checkup or an acute sinus issue. So, I average about 18 patients a day, sometimes less. The most school based telehealth that we have probably seen in a day myself has probably been about 6 or 7, and that would, of course, be during flu and COVID cold season. We can get those done and pretty quick. An acute visit at these schools takes when the telepresenter is in place and knows the equipment well. We can do these visits within about 10 to 12 minutes.
Wow, thank you for sharing that. I'm going to try to squeeze in one more question, but to attendees, please continue to share your questions. We're happy to follow up or share some additional information in our follow-up later on. For our last question, what is the upfront cost for the telehealth equipment and who shares that cost? What has been your experience?
So luckily, since PCC specializes in technology, we already had some devices like digital devices. We use laptops in our schools. We were able to donate some that we already had in stock. But another good thing about school-based telehealth just being web-based a lot of times is a lot of school nurses, if they have a computer in their office, if you can work with the IT in the school district, a lot of times they can just conduct the visits on their own device. If they have, like, all of our nurses have a private office within their nurses whole station. The other thing is the peripherals. We do use horoscopes. Those are on the upper side, and I do not have an updated price on the new ones. I do know Previously, some older models were running, they're pretty expensive, about $1,200 to $1,500 for the horoscope, and that would just be the camera component, not the stethoscope component. But then we did find some alternatives. The black peripherals that were pictured in our slide, those are Firefly, which is what we use now. And the whole set of those, the otoscope and the general exam camera together, normally runs about 500. So those have been given through Palmetto Care Connections. Honestly, we have not had to upgrade anything that we have had to pay for yet. So I can't speak on costs obtained by the schools because we were lucky enough to be able to just donate that equipment to the schools.
Oh, that's great. I'm just going to try to squeeze in one more follow-up question because we were just talking about the utilization, Bretta, and we just had a follow-up question come in. As far as utilization, are you seeing school-based telehealth visits every day?
Now, yes. At the
Okay.
beginning, no. Now during the school year, we may have one day where we don't do a school-based telehealth, but I would venture to say we do at least 4 out of 5 days. And that's just with 7 schools. You know, there's a lot of school-based programs that are a lot larger. But just with 7 schools, we're able to have at least one telehealth almost every day.
I'd like to
Wow.
add too that like Bamberg County's population is only around like 12,000. So I'm not sure if people know how the school systems work in South Carolina, but we are like little 1A. So we are like the smallest that you can get in the public school system in South Carolina. So I would imagine those numbers probably, you know, would greatly increase if we had a lot or more students.
And she mentioned our kindergarten through 6th grade school. That is our largest school. They have 700 students there. So we do a good many visits from there. But even our high school that ranges about 300. That is probably one of our biggest areas where we see patients is the high school, and some of that's to do with the nurses and how comfortable they are as well.
No, that clarity is really helpful. I'm sorry we didn't get to all of your questions, but again, please go ahead and send those and we'll try to connect you all within the communication following today's session. You should have seen the poll that popped up on your screen. It's really important that we hear from you. It helps us improve upon the training and offerings that we provide. So please take a minute just to quickly complete the poll. Thank you. I'm seeing some responses come in already. So as you all continue to do that, I also wanted to remind folks, if you are not already aware, the School-Based Health Alliance is hosting its National School-Based Healthcare Conference this summer, and you're all invited. Registration is currently open, and you can visit our website for more information. We would love to see each of you in Washington, D.C. next month and be able to talk with each of you about the wonderful work you're doing, introduce you to other colleagues in the field that you may not yet be connected to, and just take a moment to get re-energized and inspired about the important work that we're all doing. And before we end today, just a reminder in terms of how to stay connected with us, signing up for our digest, all of our social media platforms, if you are not also connected with us there. And then really just thank you for the time. We appreciate you spending this hour with us, and hopefully you got some great information out of our time together. Thanks, everybody.